of all of the services that you could do, sports medicine included everything, right? Because you had kids playing sports, you had adults playing sports, you had professional athletes, you had older athletes. Everybody was involved in sports. And the sports guys were really doing everything. And so in essence, it's a sort of a way to do general orthopedics with a focus in an area where you enjoy.
Sports have evolved. They've evolved from when athletes just kind of did that specific sport, like football. Nowadays, multiple athletes are cross-trained. There's even with the way that people train, whether it's just straightforward weightlifting or doing CrossFit. CrossFit's huge nowadays. You're seeing faster athletes, smarter athletes, more well-prepared athletes. So you're getting more people that are ready for the sport. And in saying that, there's a lot more injuries too, because they are faster. The turf changes could make a difference, whether it's artificial turf, whether it's grass, and so there's a lot more injuries that we do see because there's a lot more cross-training and a lot more, the speed of the game has changed.
When you combine the coverage of an event where the physician actually witnessed the injury, they did the first exam along with the trainer, they were able to initiate the kind of care that healthcare provider felt needed to be done immediately without delay, followed up with Saturday morning clinic, or if it's an event on Sunday, we do, other than just Friday night events, we might see somebody Monday morning. But working with the patient and the player very quickly after the injury allows us to get ahead of the several days of delay that can be part of the healthcare process. So having all the modalities of treatment for the injured athlete in one building definitely beneficial, primarily to the player patient, but it makes the physician's job a lot easier too.
One of the debates that you will always see in the sports medicine literature as well as the lay literature is the year-round sports participation now, and I think that certainly is prevalent throughout the country, where kids now are participating in their sport of passion year-round. Does that increase the opportunities for injuries, particularly overuse injuries? Absolutely. And so I think it behooves everybody to have appropriate, counseling, preseason training, throughout the season training to prevent those injuries from occurring. And when kids do have an injury, that we recognize that as soon as possible and get them in the appropriate rehabilitative treatment plan so that they don't end up having long-term career-ending problems.